At 71, Frank had pretty much accepted the usual signs of aging: frequent trips to the bathroom at night, interrupted sleep, and intimacy that felt more awkward than enjoyable. It all seemed like just part of getting older. But during a routine checkup, something caught his urologist off guard. After reviewing Frank's lab work and conducting a physical exam, the doctor looked up and said, "Frank, your prostate health is actually better than most men I see in their late 50s. What's your secret?" Frank chuckled and said, "Well, doc, I've just been a little more consistent about self-care in more ways than one." Hi, I'm Dr. Harris, and in today's video, we're going to talk about something most men do, but rarely talk about openly: masturbation. More specifically, we'll explore what actually happens to your prostate when you masturbate. The truth is, your body responds in ways you might not expect, and the science behind it might just change the way you view this private habit forever, whether you're doing it daily or haven't in years. This is information every man over 60 deserves to know. This is a topic few people dare to talk about, yet it's closely connected to senior health. If you find this topic helpful, comment 1 below and make sure to subscribe to the channel so you don't miss more important content coming soon. Now, let's get started. To truly understand how masturbation affects your prostate, it's important to first understand what the prostate is and why it plays such a vital role in your health as you age. The prostate is a small, walnut-sized gland located just below the bladder and in front of the rectum, though it's not often talked about. This little gland is part of the male reproductive system, and it does far more than most people realize. The primary function of the prostate is to produce a significant portion of the fluid that makes up semen. During ejaculation, the prostate's muscles contract to help push this fluid, along with sperm from the testes, through the urethra and out of the body. It also plays a role in fluid balance and protecting the sperm by creating a slightly alkaline environment, which helps sperm survive the acidic conditions of the female reproductive tract. As men age, however, the prostate often becomes a source of trouble. After age 50, many men begin to experience prostate-related issues. One of the most common is benign prostatic hyperplasia, a non-cancerous enlargement of the prostate that can press against the urethra and cause urinary problems like urgency, weak stream, or incomplete emptying. Others may experience prostatitis, which is inflammation of the prostate, often causing pelvic pain, discomfort during urination, and even painful ejaculation. These problems don't just affect comfort, they impact quality of life. When the prostate isn't functioning well, it can lead to disrupted sleep from nighttime urination, anxiety around sexual activity, and a general sense of losing control over one's body. Unfortunately, many men suffer in silence, believing it's just part of getting old. But prostate health is not something to be ignored or accepted passively. It's central to your ability to urinate normally, enjoy intimacy, and feel comfortable and confident in your body. Just like the heart or brain, the prostate needs care, and the more we understand how it works, the better we can support it. In this video, we'll explore how masturbation, when done mindfully and in moderation, may actually benefit the prostate, from flushing out old fluids to improving circulation and reducing inflammation. But first, we needed this foundation, because the more you understand your body, the better choices you'll make, not just for your prostate, but for your overall well-being. Now that you understand the basic structure and function of the prostate, let's talk about a critical and often overlooked aspect of keeping it healthy: ejaculation. While many men think of ejaculation purely in terms of pleasure or reproduction, it actually plays a major role in the maintenance and function of the prostate itself. Think of the prostate as a gland that stores and secretes fluid, much like an engine builds up pressure. If that fluid remains stagnant for too long, it can lead to inflammation, congestion, and even infection. Regular ejaculation acts like a flush for the prostate. It helps clear out built-up fluids, including older seminal fluid, debris, and even bacteria. This is especially important as we age, when natural circulation slows and inflammation tends to increase throughout the body. Studies have shown that men who ejaculate regularly tend to have lower rates of prostate inflammation and even reduced risk of prostate cancer. In fact, one of the most widely cited studies, published by researchers from Harvard, found that men who ejaculated 21 times or more per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. While this doesn't prove causation, The correlation is strong enough to suggest that regular ejaculation has real benefits for prostate health. But it's not just about cancer prevention. Regular ejaculation may also help reduce the symptoms of benign prostatic hyperplasia, such as urinary frequency, urgency, or weak stream. Why? Because ejaculation encourages the prostate muscles to contract and relax in a healthy way. This muscular activity helps prevent stagnation, promotes better blood flow, and keeps the gland functioning efficiently. Ejaculation also helps regulate hormones involved in prostate function. For example, it temporarily reduces the levels of certain androgens, which may otherwise contribute to prostate tissue growth when left unregulated. So in a sense, ejaculation helps keep your hormonal environment in balance, especially when combined with healthy lifestyle choices like diet, exercise, and stress management. There's also the emotional and neurological side of it. Orgasms release dopamine, oxytocin, and endorphins, chemicals that reduce stress and promote feelings of well-being. Since chronic stress and elevated cortisol are linked to inflammation and worsened prostate symptoms, this natural release can indirectly benefit the prostate by helping lower tension in the nervous system and pelvic region. Now, does this mean you should be ejaculating every day, no matter what? Not necessarily. Like most things in health, balance is key. For some men, daily ejaculation feels natural and beneficial. For others, 2 or 3 times a week is plenty. The goal is not a specific number, it's consistency over time, with attention to how your body feels and responds. The takeaway here is this. Ejaculation is not just a pleasure-driven act, it's a biological function that supports the health of one of your most important glands. And for men over 50 or 60, it may be one of the simplest, most natural ways to reduce inflammation, promote circulation, and protect long-term prostate function. In the next section, we'll dive deeper into how masturbation specifically affects prostate health, and how the way you do it can either support or harm your body over time. Now that we've established the benefits of ejaculation for prostate health, let's get more specific. How does masturbation, in particular, impact the prostate? First, it's important to recognize that from a biological perspective, your prostate doesn't know the difference between masturbation and partnered sex. In both cases, the same physical process occurs. Arousal leads to increased blood flow to the pelvic region. The prostate contracts during ejaculation, and fluids are expelled through the urethra. So when it comes to stimulating and cleansing the prostate, masturbation provides the same essential function as partnered intercourse. This is good news, especially for men over 60 who may have fewer sexual encounters due to age, energy, health conditions, or life circumstances. Masturbation becomes a safe, private, and controllable way to support prostate health, especially when it's done mindfully. Here's what happens in your body. As you become aroused, blood flow increases to the pelvic area. This increase in circulation helps nourish the tissues around the prostate and improve oxygen delivery. Then, during orgasm, the prostate contracts, helping release built-up seminal fluid. This regular movement and flushing helps reduce the risk of stagnation, which can lead to inflammation, discomfort, and potential infection. Masturbation also helps keep the pelvic floor muscles active, which is vital for bladder control and prostate support. Weak pelvic floor muscles are often linked to urinary urgency or leakage, common issues in men with prostate problems. Regular stimulation, when done properly, can help keep those muscles engaged and functioning. But the way you masturbate matters. If done too aggressively, with too much tension, or without proper lubrication, it can lead to irritation or even microtrauma to the urethra and surrounding tissues. Over time, that can cause inflammation, pelvic floor tightness, or discomfort, especially in men who already have prostatitis or an enlarged prostate. Additionally, some men fall into the trap of rushing to the finish. They use masturbation as a quick release rather than a mindful experience. This often involves clenching, shallow breathing, and tensing the pelvic region, which can contribute to chronic muscle tension and even worsen symptoms like urinary urgency or pain. To truly support your prostate, masturbation should be done gently and intentionally. That means giving yourself time, using proper lubrication, breathing deeply, and relaxing your pelvic muscles both before and after orgasm. This not only enhances pleasure, but supports circulation and helps regulate the muscles that surround and support the prostate. Another benefit of solo activity is that it allows men to monitor their own body. You may notice changes in the quality or volume of your ejaculate, any unusual sensations, or shifts in your arousal pattern. All of these can be early indicators of prostate or hormonal changes, and catching them early is key to prevention and care. It's also worth noting that masturbation can be empowering. For many older men who feel like their bodies are slowing down, this habit can be a way to reclaim a sense of control, vitality, and confidence, both physically and emotionally. So yes, masturbation absolutely affects the prostate, and when done mindfully, it can support its health, function, and comfort well into your 60s, 70s, and beyond. It's not about frequency alone. It's about how you do it. In the next section, we'll look at what happens when masturbation becomes excessive or careless, and how that can actually lead to prostate-related discomfort or dysfunction over time. While masturbation can be incredibly beneficial for prostate health, it's not without its risks, especially when it becomes excessive, rushed, or physically stressful. Like many things in life, too much of a good thing, or doing it the wrong way, can backfire. And for men over 50 or 60, being aware of these risks is essential to protecting long-term prostate function and comfort. Let's start with frequency. There's no universal perfect number, but masturbation that feels compulsive or overly frequent, for example, multiple times a day, every single day, without rest, may contribute to pelvic tension, fatigue, and even irritation in the prostate region. While occasional daily masturbation is not harmful for most, doing it out of habit, boredom, or emotional avoidance can push the body into a state of chronic overstimulation. That leads us to technique. Many men develop habits over decades that involve excessive pressure, tight gripping, or clenching during climax. These high-tension patterns can cause microscopic trauma to the urethra, irritate the surrounding tissues, and strain the pelvic floor muscles. Over time, this can result in symptoms that mimic prostatitis, including burning, aching, or a constant feeling of pressure or heaviness in the pelvic area. Another overlooked factor is ignoring recovery. The prostate, like any other muscle-involved organ, needs time to recover after stimulation. If you're not giving your body time between sessions, especially after an intense or extended experience, you could be setting yourself up for fatigue, irritability, and inflammation. This is especially true if you're already dealing with BPH, prostatitis, or other urinary symptoms. There's also a psychological component. When masturbation becomes a way to avoid stress, loneliness, or emotional discomfort, it can trigger a cycle of short-term relief followed by emotional or physical depletion. In these cases, men often report that they feel drained or agitated afterward, rather than relaxed or satisfied, and this kind of imbalance can subtly wear down the nervous system and increase inflammation throughout the pelvic region. Warning signs that masturbation may be contributing to prostate problems include persistent pelvic discomfort or pressure, frequent urination or burning sensation afterward, reduced sensitivity or weaker ejaculation, feeling sore, tight, or tense in the lower abdomen or perineum, emotional irritability or brain fog post-ejaculation. So how do you avoid these risks? First, slow down and be intentional. Shift your mindset from release to reconnection. Use lubrication, breathe deeply, and pay attention to your body's cues. If you notice tension building in the pelvic area, pause and allow it to soften before continuing. Don't rush toward climax. Let the process unfold with relaxation, not force. Second, build in recovery time. Like any other form of exertion, your body needs rest. Give yourself a day or two between sessions, especially if you've been experiencing discomfort. Use that time for hydration, gentle stretching, walking, or activities that release tension in the hips and lower back. Finally, be mindful of your emotional motivation. Are you doing this to reconnect with your body, or to distract from something you don't want to feel? When masturbation becomes a tool for avoidance, it can lead to a cycle of tension that directly affects your prostate and overall health. In the next section, we'll flip the script and talk about the surprising benefits of healthy, mindful solo activity, especially when done with the prostate in mind. By now, we've looked at both the potential benefits and risks of masturbation as it relates to the prostate. But let's dive into some of the lesser-known, but truly surprising ways that healthy solo activity, when practiced mindfully and in moderation, can actually enhance prostate health and your overall well-being, especially after age 60. One of the most talked about benefits is reduced risk of prostate cancer. As mentioned earlier, a large study from Harvard found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer. Researchers believe this is due to the regular clearing out of old seminal fluid and cellular debris, which could otherwise build up and create an environment more prone to mutation and inflammation. While ejaculation alone isn't a cancer cure or guarantee of prevention, it appears to be one of many lifestyle habits that support long-term prostate health. Another powerful benefit? Reduced inflammation. Chronic inflammation is a major contributor to prostate issues such as BPH, prostatitis, and pelvic discomfort. Ejaculation, when performed without excessive tension or stress, activates the pelvic muscles and helps clear out inflammatory byproducts. Plus, the post-orgasm release of endorphins and oxytocin naturally lowers stress and cortisol levels, which are both known to fuel inflammation throughout the body, including the prostate. A third, often overlooked benefit is better bladder control. When you engage your pelvic floor muscles during arousal and orgasm, you're essentially giving them a light workout. These muscles support your prostate, bladder, and urethra. When kept strong and responsive, they help reduce symptoms like urinary urgency, dribbling, or nighttime urination. In this way, mindful masturbation can complement pelvic floor exercises like Kegels, especially for men over 60. And let's not forget the emotional and psychological side. Many older men struggle with shame, disconnect, or frustration when their sexual health changes. A healthy solo practice can be a powerful way to rebuild confidence, re-establish body connection, and even improve intimacy with a partner. When masturbation is approached not as a guilty secret, but as an intentional act of care, it becomes a way to affirm your health, autonomy, and masculinity. What's key here is the word healthy. That means you're not doing it out of compulsion or emotional escape. You're using proper lubrication and technique. You're taking time to breathe, relax, and notice sensations. You're giving your body space to recover. When these elements are in place, masturbation becomes more than just a release. It becomes a tool for maintaining circulatory, hormonal, muscular, and emotional balance. It encourages better blood flow to the prostate, stimulates healthy contractions, and supports the natural rhythm of the male body. In many ways, healthy masturbation is like a maintenance routine for your reproductive system. Just like brushing your teeth or exercising, it keeps things working properly and prevents future issues. It's not about frequency for its own sake. It's about consistency, awareness, and care. In the next section, we'll talk about the best practices for how to masturbate prostate-smart, including timing, position, techniques, and recovery strategies that protect and even strengthen your prostate health over time. Now that we understand the potential benefits and risks of masturbation for the prostate, let's talk about how to do it the right way, the prostate-smart way. First, timing and environment matter. Don't treat masturbation as something to rush through in a moment of boredom or stress. Set aside intentional time, ideally when you're relaxed, unrushed, and in a calm setting. Morning or early evening often works best, when energy is steady and distractions are fewer. Next is preparation. Just like stretching before exercise, your body needs a moment to transition. Start with slow, gentle touch. Focus on breathing deeply. This helps relax your pelvic floor muscles and improves blood flow to the prostate. Shallow breathing and clenching the abdomen or thighs can create tension in the pelvic region, the exact opposite of what your prostate needs. Lubrication is essential. Dry or rough stimulation can irritate the urethra and surrounding tissues. Use a gentle, natural lube. Avoid anything with synthetic fragrances or alcohol. Friction should be minimal, and the experience should feel smooth and controlled. As you approach climax, avoid tightening your entire body. Instead, stay relaxed, especially through the pelvic area. After orgasm, take a moment to lie still, breathe deeply, and allow your body to reset. This post-orgasm recovery is just as important as the act itself. It promotes parasympathetic nervous system activation, which supports healing, circulation, and hormone regulation. Frequency also matters. While there's no magic number, most men do well with 2 to 4 sessions per week. Listen to your body. If you feel drained afterward, give yourself a longer break. If you feel energized and clear-headed, you're likely doing it right. Lastly, remember that masturbation isn't just a physical act. It's an opportunity to check in with your body, monitor for changes, and reinforce your connection to yourself. In the final section, we'll bring it all together and review why understanding this private habit may be one of the most powerful steps you can take for long-term prostate health. Let's take a step back and reflect on what we've uncovered today. The prostate is a small but mighty gland, essential not just for sexual function, but for overall male well-being. And while it's often overlooked or misunderstood, how you care for it can shape your quality of life well into your 60s, 70s, and beyond. We've seen that healthy masturbation isn't something to feel ashamed of. It's a natural, functional part of male biology. When done mindfully, it can reduce inflammation, flush out the prostate, support hormone balance, improve bladder control, and even lower your risk of prostate cancer. But the key is how you approach it, with awareness, gentleness, and intention. It's not about being perfect. It's about being informed. Every man's body is different. Some may feel great with 2 to 3 sessions a week. Others may benefit from more or less. What matters is that you listen to your body, avoid high-tension habits, and treat this private time as part of your self-care, not something shameful or automatic. If this video helped you better understand your body or gave you something new to consider, please give it a like, share your thoughts in the comments, and subscribe for more science-based health guidance made specifically for men over 60. I'm Dr. Harris, and I want you to know, you're not broken, and you're not alone. With the right knowledge, your best years and your best health may still be ahead of you.